evening, Dilip sir.
Good evening, Angeline. How are you?
I'm fine, sir. Good evening, Patta, and good evening to
Good
every
evening,
one
good
of
evening.
you here. And thank you to Vidya also. I will be making a brief introduction to Dr. Dilip sir. I'm not able to just like that talk, so I will be reading from my phone. Apart from learning from Dilip sir, I owe him a lot personally as a recent excellently recovered patient of his. I had been his assistant for many years in two stints. Working with him, I realized academics is not what you do on a blackboard or using the latest PowerPoint version or your bedside clinics. Working with him, I realized academics is handling that huge and varied patient requirements that a busy headquarters hospital requires. Academics is managing 40 admissions in a single day with no layered junior help. Academics is keeping an eye on 3 OTs at the same time. With no room for error. He would leave administrative meetings in the secretariat to come running to the operating room to bail out a surgeon who has goofed up his surgery. Sir would accept all cases referred from, no cribbing, no boasting, pure patient care. He gave a lot of encouragement and administrative support to research in GH to whoever was interested. This led to a slew of research papers on trauma from GH that ultimately earned us a citation of GH itself in the white paper recommendations on trauma to the government of India. How to treat my female colleagues and my female residents. His humor would keep us in splits in the OR. A very personal issue. When COVID was cited as the cause for elective surgery to be impossible in Pondicherry, so that I could get my chemotherapy on day 19 post-op. I owe a lot to Dilip sir, and Revathi madam was always with us throughout this ordeal. Thank you, sir, and thank you for my personal side as well as accepting to be on this Zoom meeting. Thank you so much, sir. I will take your leave now and try to join at the end of the program. Thank you all very much. Thank you.
Thank you so much, Angela. Nice seeing you. And, we are really touched by your words of appreciation of Dr. Baliga. Although many of us didn't have any personal rapport or working with him, we can understand from your words the amount of, importance you give to him. Sir, back to you, Dr. Dilip, sir. You can share your screen now. If you have slides.
No. I don't have any slides. I am not all that techno savvy. But let's have a just, But first of all, I must really appreciate the symbolic cartoon of a steam engine in your teaser. I have been an incorrigible smoker for half a century now. And the smoking engine really depicts probably my habit. Anyway, see, journey, when it is enjoyable, destination doesn't matter. Destinations are not the aim of the journey, but enjoying the journey itself is a lifetime achievement. I never had any destination in mind when I became a surgeon. I enjoyed my journey so much. Reminds me of one of my classmates in 1967 when I joined JIPMER. There were quite a few from Delhi. The Tamil Nadu Express was introduced just then. It took hardly 36 hours. Am I audible? But am I
Yes,
audible?
yes, sir, very much. Loud
Okay.
and clear, loud and clear.
It took only 36 hours from Chennai to Delhi. It was a marvel at the time. Everybody, wanted to book the ticket to Delhi in Tamil Nadu Express. A classmate of mine, he would always book his ticket only in Jammu Tawi. It used to take nearly 4 days. Everybody used to laugh at him, but he could not understand. He said, I enjoy train journey. For the same amount I pay, I am traveling for 2 extra days. So I feel like that friend of mine from 1967. I enjoyed this journey. I continue to enjoy this journey. Destination doesn't matter. Time doesn't matter. So when I joined JIPMER in 67, I had no intention or no idea what I was going to become. But it was a fantastic place. JIPMER was a great place. I had a new experience because this was a place in those days, only 65 students were taken every year. And in the 5-year period, there'll be hardly about 300, 350, and everybody knew everybody else. Same with the staff. The faculty was very forthcoming, they were very helpful, and we could go to their house, enjoy a cup of tea, immaterial, whether they were teaching you or they were from some other specialty. It was, days were like that. JIPMER was just coming up. When I finished my MBBS, of course, I failed in my general medicine. I wanted to become a physician by the time I was somewhere in the 4th clinical year. I was very much impressed by Dr. Chandrasekhar, who had later on he became the director of JIPMER, a great physician. We used to call him Cho, very humorous guy and highly knowledgeable. He had returned from US, and I was very much impressed by him, and I wanted to become a physician, and I was reasonably good in general medicine. But as fate would have it, when I appeared for the final year examination, I was too smart. So in those days, all our exams, right from our organic chemistry to final year, everything, all clinicals and practicals were in only 2 places. Either it is Stanley or it's in MMC. And it's with a mixed gathering of all students from northern part of Tamil Nadu and including CMC Vellore. In the clinics, I failed, and I was told the reason why I failed because I commented on something about Austin Flint murmur as, that could be a cause as a differential diagnosis for mitral stenosis, something like that. So I was told by the examiner that Austin Flint murmur is a phonocardiographic finding. Nobody can hear it. So I am failing you. You openly told me why you failed me. So having failed in medicine, somehow I got dejected. And by the time I came back and started my house surgency about 4 months later, all the central government medical institutions went into strike. That's the time we didn't have this residency program. We were getting paid about 100 rupees as compulsory house surgeons, and PGs were not getting paid anything at all. In fact, they had to pay a fees, not much, some 250 rupees a year or something. So in the first year, at least one could become a senior houseman and earn about 250 rupees. But after first year, second and third year, they have to work gratis. And majority of them used to fail in the post-graduation because in those days, passing a postgraduate examination was not an easy job in the Madras University. And if they're fortunate, they'll get a registrar post. There were only very limited registrar posts and they were paid 500 rupees. So they used to stay there for next 3 years and try to pass the PG examination. So there was not much competition to become a postgraduate in those days. What happened was when I was doing my compulsory house surgency, one night I was just doing a suturing for an accident case. Some agriculture officer or somebody who was riding a motorbike had fallen down and had a lacerated injury of the thigh. Under local anesthesia, I was doing a job, and Professor Verma, he was the head of the department of surgery at the time. He had resigned from Tamil Nadu service and joined the central services. He was head of the department. He just walked in at about 8:30 or so in the night into the casualty OT. It was an open OT, like side OT. I didn't notice him. He was standing behind me and watching me do the suturing. Then he said, you should take up surgery. I looked, then only I noticed it was Verma. And I remember the another thing is that he asked the patient, suddenly he asked, it's a nice job, how much would you pay? I was shocked because JIPMER, everything was free. And the professor asking the patient, how much will you pay? And the agriculture officer looked up and down and he said, probably 25 rupees. Professor didn't say anything. Then the man wore his pant. Verma said, nice pant. Where did you get it stitched? He said, Nanwani's. It was a very famous tailoring shop in Pondicherry at that time. How much did you pay? He asked. He said, 50 rupees. Verma smiled and walked away. So that is the same situation that prevails even today. If somebody asks me, the doctors are charging more, I ask them, how much did you pay to the service station to get your car serviced? This is just as an aside. So that put in a seed of, you know, intention in me that probably I should do surgery. The postgraduate examination, entrance examination was started that year, and I had missed it because I had failed in the first, in my final year. By that time, I was already married. I was 24, I was married, and I needed a job. So I joined the pathology department as assistant clinical pathologist. There, it was a great experience because every day we will get specimens from the OT. And it was my duty to gross them, record, the appearance and things like that, and then do the sections, give it for sectioning. Similarly, in the afternoons, I have to go and do the postmortems. All of you will realize that dissection in a cadaver in anatomy is entirely different. It's a mummified body. You just have a vague idea, but doing a postmortem is a fantastic experience. That's where I learned inside the abdomen, all the spaces, the peritoneal reflections. By the time I worked for about nearly 5-6 months, I was very thorough with the peritoneal reflections and the major vessels where they are situated and a few abnormalities in the vessels where it could be found and things like that while I was doing the postmortems. And when I was doing my house surgery, also compulsory house surgery, I did 1 month of elective posting in anesthesia. Kangle was a great teacher, and Dr. Chakrabarti was there. And it so happened that most of my anesthesia postings were in surgery OT was when Dr. Smiles was operating. It was a great pleasure watching Dr. Smiles do the surgery. It was so precise and delicate handling of tissues, and he never used to lose his temper. Oh my God, I had seen a lot of senior surgeons lose the temper, throw the instruments about, and hello, am I audible?
Yes, sir, very much, loud and clear.
Because so many things are coming here on my screen.
That's okay. I mean, you're very much audible, sir.
Very clear. Very clear, sir.
Okay, because I'm not able to see anything here. Again, it is asking me to sign up. I don't know why.
No. You continue. Speaking.
I can continue because I am not able to see you. Your face is blocked. So I feel like, I'm talking to your wall.
No.
Hi.
What? Kumaran.
Kumaran, you are on.
Okay. Dr. Kumaran, can you just lower your laptop? We can't see your face fully.
Hi, Kumaran. Kumaran is a great friend of mine. He's a classmate of mine. And if I tell you the story about how we came together, it's a fantastic
well, you should
story.
tell, sir. You have 2 full hours to talk.
Okay. Now that Kumaran is there, I will tell you a great story. What happened was, I come from a very, very orthodox, very, safeguarded family setup. And it so happened, I wanted to write the entrance examination for JIPMER at that time. And the examination was in Pondicherry. My parents were a little scared because whole of Tamil Nadu was dry and everybody knew Pondicherry is a place where there is a lot of drink. And so anyway, my dad sent me to Pondicherry with an escort. But before that, he talked to a friend of his, whose friend was another man in Pondicherry, who agreed that he will put me up and take care of me, no harm will come to me and things like that. So when I reached Pondicherry by train, I was picked up by a person who introduced himself as a friend of my father's friend, and he took me to Liberty Hotel. I think, Patta, you must be knowing Liberty Hotel.
Yes,
on the railway station. Great place in those days it was. And as I entered, there were a group of other boys there, and he introduced that one of the boys is Dr. Kumaran. He is not doctor at the time. This is Kumaran, my nephew. He is from Laila College, he did his PU. He's appearing also for this examination, and his friends. They're also staying in the same hotel. So we stayed in the same hotel. Evening, I went out for a walk to see the beach and all that. Came back at about 7:30, and what do I see? As I enter in the lobby itself, these friends and Kumaran are sitting with a bottle, and they are making riotous party there. I got scared. I ran up the stairs to my room. I thought, how these fellows are appearing for this exam. Fellows are getting drunk the previous day to write the exam. The next day, this uncle of Kumaran came and picked us all up in his car and dropped us in the seminar. And we looked at the board. My number was in a particular. I go and sit there. And who is sitting next to me on the next bench? Kumaran. So I said, what, this fellow also is sitting in the same. Anyway, I knew that this chap is not going to get this a tough examination. I finished the examination, went home. And after 3 weeks, I got a call. In those days, the open general seats were only 36, and 72 people will be called. Out of all the people who wrote the exam, only 72, double the number, will be called for an interview. And the interview was in Madras University, in the Vice Chancellor's chamber. A.L. Mudaliar was the chairman of the interview board, and our principal, Dr. D.J. Reddy, was a member, and another person was the director of Vishweshwaraya Institute of Science, Bangalore. And it went on well. I did fairly well. And I see Kumaran also sitting there. I said, how the heck this fellow is coming here? Anyway, very next day they published the result and asked us to go directly to JIPMER for a medical checkup. So next day at morning, I find that I have been selected. Then there was another chap who was with me who got selected. Both of us decided we'll straight away proceed to Pondicherry. In those days, there was a Tiruvallur bus to Pondicherry at 3:30. I get into that bus with my friend, and the bus stops at T Nagar to pick up some more people. And who do I see? Raj Kishore Bagdi. Bagdi also got into the same bus. Then we all came and reached. It used to take about 4.5 hours from Madras to Pondicherry. It was nearly about 8 o'clock. We reached JIPMER. That's a big story. How we were welcomed by our seniors, made to feel very much at home. They took us to the mess hall. They accommodated us in the rooms. It was a fantastic experience. JIPMER was a great place. I decided I am going to stay here. So I got my medical checkup done next day and went off to my place. My parents were at Dindigal at that time. Within 15 days, I had my interview in Madurai. So for the Tamil Nadu Medical Colleges, I went to Madurai. This interviews runs over a period of 30, 35 days. And my timing was given after 2 o'clock. I go there, and whom do I see? I see Kumaran again. Both of us on the same day, same place. So we did the interview, said hi. Then once I came back, I got into the hostel. Kumaran was staying in Pondicherry. His grandparents' house was here. His great man. His grandfather was here. His uncles were here. So he was a day scholar. My roommate left halfway through. He had to go away for personal reasons. He went and joined Karnataka Medical College. I was alone in the room. Then suddenly one day I get to that your room, you are getting a roommate. Whom do I see? Kumaran again. And ever since we have been together. So this is my story of Kumaran and myself. It was predestined, preordained, nobody could have separated. That is a great time. So naturally being with Kumaran, we smoked together, we drank together, and I learned to ride a motorcycle. On his motorcycle, he bought a bullet in the final year, and I painted the number plate also. I had a very good calligraphic handwriting those days. It was a great thing. Nice to see Kumaran. I miss you. Because of Corona, he's not coming. Otherwise, once in a month, he'll come here and we used to have the same good time. But Rajkumar's birthday, we celebrated, only two of us. Okay, anyway, this may not interest many of the other viewers who are not probably from JIPMER. So this is how the seed of becoming a surgeon was sown in me. Dr. Verma's observation that I should take surgery probably, and watching Dr. Smiles, a fantastic surgeon, a cool and collected, calm surgeon, and a very friendly surgeon. and my limited experience in pathology and in postmortems. So next, hello Bharti, nice seeing you. Am I audible? I'm getting some interference.
घर में है ना आजकल गाड़ी इधर ही रहती है.
Yeah. Raj, I'm audible, Raj. Raj, are you able to hear me?
Yeah,
okay.
I can hear you.
Because I'm getting a lot of interference from some other voices.
No, Bharati is walking down with her.
Okay. Yeah. So it's nice to see Bharti. So what happened was, mind, loses the thought. Where was I? See, age is catching up with me. Yeah, why I became a surgeon. So next time when the entrance examination was conducted for the PG, I applied for both pathology and general surgery. I'm very thankful to Dr. Majumdar and Dr. Yadav who were there in the interview both. The entrance examination was common to anybody who wanted to appear. Naturally, they will reduce about 5 marks for one failure. So I already lost my 5 marks in the theory examination when I wrote the theory examination. At that time, there were 6 seats for general surgery. For 3 units, 2 seats each. And out of the people who wrote the entrance examination, only 30 people, top 30 from the theory will be selected and called for an interview to select the 6 candidates for the 6 seats. And the interview board was naturally having the principal and Dr. Satyaprakash, who had become the head of the department by then. He was there. He didn't have much, acquaintance. I did not have much acquaintance with him because he joined a little later. When I was doing my house surgery, Dr. Verma only was there. But Dr. Majumdar and Dr. Yadav had seen me work as an intern. And probably they were very much impressed with my thing. They gave me a lot of rope. They asked me a lot of questions. Nobody was interviewed for such a long time. But in spite of that, because I had lost 5 marks already, I was on the waiting list. So I went and joined pathology. Pathology I got straight away because I was already working as an assistant clinical pathologist. I needed the job. And it was not a permanent job. It was a job which was there on ad hoc basis. I was accommodated. Anytime a permanent fellow gets selected by UPS incomes, I'll be thrown out. So I thought it is a better option to take the post-graduation in pathology because I'll get at least 500 rupees. By that time, we had got the residency program. And as I said, I was already married. So what happened was I joined pathology for MD pathology. I registered for MD pathology. 2 months later, I find that the list has moved on. Already the course has started, but somebody had left. And that seat was offered to me. I very happily went and said, okay, I am joining. But then they got the form, everything. Then suddenly after 1 week, I was called back and said, sorry, you cannot join MS General Surgery because the university is not registering you. They're saying they've already registered you for MD pathology, so you cannot be registered for MS General Surgery at the same time. So we have to offer it to the next person on the list. I asked the principal to wait for a day. I rushed to Madras. I ran from pillar to post. Nobody was willing to help me. They said, nothing doing. You see, from JIPMER, we got a registration for MD pathology 2 months back. We have registered your name for MD pathology. You have paid the registration fees also. Now, how can we register you to MS General Surgery? So I talked to all the clerks, office superintendent and all that. I was practically in tears. I was just coming out of the university. I said, as a last attempt, let me go and meet the registrar. I just walked to the registrar's office. Luckily for me, he was inside. I said, tapped on the door and went to the registrar. I said, what? I said, this is my problem. He said, naturally, yes, you cannot do that. But why all this hullabaloo? You just give a letter saying that transfer my registration from MD pathology to MS General Surgery. We will transfer it. You need to pay additional fees, also new registration fees. You have already paid the registration fees. So it was providence that made me a surgeon. It was always, it was there guiding me. That's what I take it like that. Because all the other lower clerical staff told me it's impossible. And by chance, I walked into the registrar's office, Madras University or the beach club. And he just received me and said, okay, what is the problem? He said, yes, what they're saying is correct, but we will transfer your registration from to this to that. I saved 300 rupees also, registration fees in the process. So I came back and joined the general surgery. It was, a general surgery, all were considered by other PGs as, ruffians. They were the fellows who used to get drunk, make the maximum galata in Harvey House. In any trouble, there'll be one surgery PG involved. Yeah, but it was a great experience because everybody was friendly. I can tell you now that how was the teaching in those days? All the fundamentals, procedures, SOPs, everything we learned only from our seniors and from the registrars. What we got from the chiefs was pearls of wisdom. They will not take a didactic lecture or hold your hand and do anything. As far as theory is concerned, it was assumed that as a PG, you are going to read up your theory. Nobody bothered about theory. Yes, we had journal clubs in a month, clinical meetings, clinico-pathological exercises, death meetings. That's fine. But there was nothing theory-oriented. Nobody even asked, what are you reading? Have you prepared this? Never. The great experience of learning was whenever something went wrong, when a patient didn't fare well, usually either the registrar or the PG who was looking after the patient, he'll go into a sort of a depression. Most of them were committed. Not all of them were committed to the patient care. And even though chiefs may not have reprimanded them, they were reprimanding. It was a self-flagellation by the person who was looking after that patient. In the evening, the only way we all knew how to recover from this pathos was to have a drink. And the whole case will be discussed threadbare. It may not be from the same unit. All fellows will come and join because booze is provided. It is there. Somebody will bring a bottle. He may come from anesthesia department, from some other unit. It may be a pathologic PG. In an effort to console that fellow, everybody will talk and somebody will talk about the latest developments in the field. It was a great learning experience. We learned it the right way, I think. That is the way. And you never forget such. It was in such a good camaraderie. What you learn, it stays with you for a lifetime. More than the death meetings, I enjoyed these drink meetings after deaths, which brought in a lot of clarity about how you see a patient, where we go wrong usually, what are the signs of early complications that we tend to miss. Somebody would have read about it and he will come and tell, next time we have to do this, man. This is what it is said. It's a fantastic experience. It's learning from your own peer groups and immediate seniors and the registrars. We had fantastic registrars, James, Pashupati. We had a tough nut Srinivasan. I don't know whether you may not know him. He left after 3 years. Most of them went off to United States and United Kingdom. He was a stickler for definitions. He used to say every word in a definition has a meaning and a purpose. You cannot miss anything. We cannot just say, if you ask a question, what is a strangulated hernia, you could not just blabber and say, sir, it loses its blood supply. It has to be told. A strangulated hernia is a tense, tender hernia, the blood supply to the part of which is seriously jeopardized, rendering gangrene imminent. So I still remember. So this is how the definitions have to be. You cannot tell the Courvoisier's law. Now you ask anybody what is Courvoisier's law, they will give they'll come to the point. But in a patient with obstructive jaundice, if the gallbladder is palpable, in all probability, it is not due to stone disease. This is the definition. It has to be like that. So he was a stickler for that. Like that, we learned a lot of things from registrars. And we could sit together with a glass, that is where these discussions occur. Though chiefs will never ask any theory question. It's all patient-oriented, that patient-oriented questions. 3 instances in my postgraduate period really stuck in my mind. One was, I happened to accompany a plastic surgeon, Tiwari or something. He was there only for a short period to a court case. It was before my, am I audible, Patta? If at any time I'm not audible, please wave your hand.
Very, very clear, sir.
Okay. So in those days, sometimes when the unit chief is on leave or unable to attend, they used to post somebody else, one of the other consultants, as a standby on call. Dr. Tiwari apparently was on call. It happened before my time. And there was a patient who had been stuck with a crowbar by 3 or 4 of his opponents, and that fellow was brought in a very moribund condition from near somewhere in Tindivanam, Tamil Nadu area. So the registrar, who was not a postgraduate qualified, but most qualified in the sense that he had been working in surgery for a long time, he sent a call to Dr. Tiwari. Tiwari came and said, the patient looks bad. Yes, he looks bad, sir, but I think we should make a burhole in case if there is any collection, because X-ray shows fractures, we should at least do something to relieve the compression in the brain. And he agreed. But he, being a plastic surgeon, he was just standing by the side, and the registrar did biparietal burhole. Of course, there was a lot of hemorrhage and nothing, there was no compression as such. The brain was damaged. Next morning, the patient died, and this became some sort of murder case, and all that went on. I was not there. It happened before my time. But it so happened, when I joined my first MS, Dr. Tiwari was called to court as a specialist witness and things like that. And this was in somewhere in Changalpet Sessions Court or something like that. We went through the case sheet. Name was put as Dr. Tiwari. So he wanted somebody who could talk Tamil. He did not know the local language. So I accompanied him to Sessions Court. There, the defense lawyer asked him, what are you doing? He said, I am a plastic surgeon. Not a neurosurgeon? He said, not a neurosurgeon. Immediately, this fellow picked up a book, the defense lawyer, and showed him that the mortality rate in craniotomies can be upward of 6 to 12% even in expert hands. Do you agree with this? You have to say yes. When did you last do a burrow? He asked Dr. Tiwari. Tiwari said, when I was doing my post-graduation in MS. When was that? He said 15 years back. You did it? No, I assisted. So 15 years back, you assisted on a burrow. 15 years later, you are doing a burrow now. I am not blaming you, you have to do it. But what do you think your operative mortality will be? Will be 6%, 20%, 30%? He could not answer it. You are not a neurosurgeon. You have never worked in neurosurgery. While doing MS, you assisted 1 or 2 craniotomies, and now you are coming and doing burrows in an emergency situation. Is it possible the patient could have died because of your surgical intervention? Is there a possibility? He could not say anything. He just said, yes, you have to agree. I always remember this. I keep telling after that, when I started doing my surgery, and we used to get a lot of trauma cases when we started trauma unit also. I keep telling everybody, unlike a disease, a trauma is an instantaneous. It is a force which acts. It causes the maximum damage at the time of impact. Over. It will not linger on. Unlike a disease which can linger on, can wax and wane. Whereas a trauma, whatever the worst it can do, it does at the time of impact. And if a person has survived, that impact and has been brought to the hospital in live condition, if he dies, it is only because of some super added thing. Be it hemorrhage, it may be a rupture, it may be a perforation. All these things we are qualified enough to diagnose and treat and control. So I tell them we should take it as a personal insult. If any trauma patient comes to us alive, and if he has to die on our hands, we have missed something somewhere or not competent enough to tackle. This I learned from the court case, which I attended when I was in the first MBBS. The second instance is very, very, I feel even now a little bad about it. Dr. Sibal, who was my chief, had done an open prostatectomy. He is a fantastic surgeon. Very meticulous, beautiful surgeon, and a very kind and nice man. Patient was, 60, 65, diabetic, all those things. On the third or fourth day, we removed his suprapubic Malico catheter. And on the sixth or something, he told me, okay, it was a OT day. Chief was operating in the main theater, side room. He said, remove the catheter, urethral catheter, and dilate him. I was good at dilatations. So I was washing my hands and I told Manuel Raj, I don't know how many of you remember Manuel Raj, he was the OT assistant in JIPMER. Manuel, pull out that catheter, police catheter, I will come and do the dilatation. He comes back saying, sir, the tube இழுக்க முடியல சார். Hey, police catheter இது பண்ணி எடுக்கணும். He said, no. அது ரெட் ரப்பர் catheter சார். ரெட் ரப்பர் catheter எப்படி இருக்கும்? அது இழுத்தினா வரும் சார். ஒரு இழு கொடுத்தினா வந்துடும், அங்கேயே மாத்திட்டு. ரெட் ரப்பர் catheter எப்படி உள்ள இருக்குன்னு கூட I did not think. That fellow pulled. One big noise came. I rushed there. What had happened was, on the day probably there was no police catheter available. Police catheters were, rare things in those days. So Sibyl had put an ordinary red rubber catheter, but because it should be self-retaining, he had taken a thick silk, tied it up, and across a small bit of rubber tubing, and he has fixed it near the suprapubic opening itself. So when this thing was pulled, the whole wound gaped open. The red rubber catheter was pulled with the thread attached to it at the tip, and the rubber tubing, everything went into the bladder lay open. I rushed in there. I thought finished for me. So immediately what I did was I called one of my anesthesia colleagues. That fellow put a mask on his face and opened up halothane for some time. Quickly I gave a wash and closed the bladder, and then I put in a catheter again. So Sibyl asked, did you remove the catheter? I said, no, sir, I removed it, but I could not dilate, so I put the catheter again back. I just bluffed. Next day, by evening, patient was all right. Third day, he started very high temperature, shivers. We had only gentamicin and ampicillin those days. And his diabetic status was uncontrollable. On fourth day, patient died. Chief said, sepsis, this happens in diabetic patients, we cannot be too sure, especially with the chronic retention of urine, cystitis. Okay, he just walked away from the rounds. I felt bad. I went to his room. I was practically in tears. I told him, sir, I want to quit. This is what happened. It was my fault. And he said, yes, you should have told me. Not that anything extra would have happened. That could have led to the infection. But don't talk about quitting. This is not the first death you are going to have because you did something wrong, and neither it will be your last. See to that it is far in between. Every surgeon has a story to tell like this. You are not the first person, you are not going to be the last person. So this is the second lesson I learned, that no matter how clever we think, how qualified we think, how expert we think, there will be situations where certain actions of yours on the table will haunt you. One has to live with it. The third one is very hilarious because there was a second unit chief, a great man called Dr. Mediratta. Dr. Mediratta, will pretend as if he doesn't know anything. Initially, because he had come from North suddenly, and all of us thought he really didn't know. He will pretend so much. He will not say what, he will ask. Everything Smiles will have to tell you. He will open, Smiles, you sure this? Yes, sir, this is inferior vena cava. Are you sure, Smiles? We should not cut it. No, sir, you should not cut it. Then he will reflect some more and say, Smiles, what is this? Something is there. This is what? He says, sir, it's a portal vein. Okay, so we should not touch it. No, sir, you should not touch it. Like this, right? And all of us PGs standing over were standing, they will. So the news started spreading that Mediratta knows nothing, and I don't know how he became professor and things like that. We were talking and we used to make fun of Mediratta's PGs. I don't know how you guys are going to learn anything from him and things like that in the mess hall. Somehow the news got onto him. We used to have grand rounds once a month by all the PGs were allowed to join. So Mediratta's rounds, we were somewhere in 1976, I think. Dr. Mehta was his assistant professor or lecturer at that time. Smiles was, of course, his Mediratta's pet. Smiles was there, some registrars, and all of 6 PGs. Suddenly, yes, what is nosocomial infection? Mehta, what is nosocomial infection? You asked assistant professor. Assistant professor looked this way, that way, said, I don't know. Smiles, what is nosocomial infection? Smile said, I don't know. He asked the registrars. Yes, like that. Then suddenly there was a very bright postgraduate, very bright, supposed to be a best among the PGC. He looked at him and said, what is nosocomial infection? He also said, I don't know. You don't know. Then he looked around. There was one first clinical year student who was writing history in some other bed. He said, come here. Okay. What's your name? He told his name. What is nosocomial infection? He said, sir, hospital cross infection, sir. Any infection that is acquired in the hospital is called nosocomial. Oh, that I happened to read it in the journal yesterday. Well, that is what is nosocomial infection. Yes, sir. How do you know this? Sir, yesterday they took class in microbiology on nosocomial infection. So then he said, he looked at all of us and said, just because I don't know something, some terminology, don't think I am a moron. See, you all finished your MBBS only 5 years, not 3 years back. But in these 3 years, the first clinical year student knows nosocomial infection and you don't know. So much new developments are coming. Just because you don't know something that has come new, that doesn't make you a moron. In fact, at your age, I was much more brilliant than you. That is why I could become a professor at this age. Looking at you people, I don't think you will ever become professors in your lifetime again. Because I was much more brilliant. So these 3 lessons I will always carry with me as a surgeon, because I learned that nobody is infallible. I learned, see, very, very clearly put, nowhere in the textbooks this is given. One lawyer had to point it out, that anybody who survives a trauma, why should he die? He has survived the trauma, finished. If he is dying, it is only because we have missed something, we are not able to manage it. That is all. Hello? But I am getting the black screen. Hello?
Yeah, Alex, somebody else had comments. Sir.
Okay.
You continue speaking, sir, but your thoughts should not get broken.
Yeah, I am getting dementing, So what happened was, that is 3 lessons I learned as a postgraduate. One, the developments in academics, in knowledge, will far outpace your capacity to learn it. But that doesn't make you any inferior or inefficient or unqualified. Trauma has to be taken very seriously. It should be taken as a personal insult by every surgeon who tackles a trauma if he loses a patient. The third one is that nobody is infallible. We have to be humble, you accept, yes. So don't torture yourself if you lose a patient. You have to accept it philosophically, yes, this happens. Okay, anyway. Anybody wants me to carry on with the JIPMER days or further on?
Sir, you continue with your own way. I mean, we can't leave JIPMER so soon.
Yeah. It's fantastic. Anyway, I'm very fond of narrating the humor of Dr. Satyaprakash. Dr. Satyaprakash was stickler for words. He was he had spent about 8 years in UK, and he could not tolerate any of these mispronunciations and any grammar mistakes. All these things he will correct in a very, very polite way. He will correct. Once what happened was at early morning 6:30, I was returning from town. You know this staff quarters road. Staff quarters. I was coming into the staff quarters road. I have to take a left turn to enter into Harvey House Road, and there is the Charaka statue is there, and around that usually there'll be some sand. I had missed it. I was being young. I was riding at nearly about 60 kilometers speed, and I applied the brake to take a right turn. I was thinking of something. It was too late, and rear wheel started skidding. I got scared and I just held it straight. So the vehicle at that speed, the bullet jumped. I was hardly 45 kilograms weight. The vehicle jumped across that ditch. There is a rainwater drain, huge ditch, and there is a casuarina fence of about 4 feet high. That's Dr. Satyaprakash's residence quarters. The vehicle went right through the casuarina fence. The handbar, everything went in. I am sitting in the middle of the casuarina fence like a red Indian with a lot of these casuarina things coming in. And in my panic, I was holding the throttle fully up, and the rear wheel was trying to spin, and a lot of smoke was coming in noise, but it is wedged in the ditch. Hearing this noise, 6 o'clock in the morning, Satyaprakash came running onto the balcony. First thing he looked, he knew I was safe. You know what he said? If you want to come to my house, come through the gate, you see. Then he came down and helped me to pull out the thing and all. So I remember like that, Dr. Mediratta, great man, Dr. Chowdhury, one of the excellent teachers, great sitar player. I had spent a lot of time in Dr. Chowdhury. It was said there is no surgery, no condition that is inoperable for Dr. Chowdhury. So he will take up any case, even malignancy which had spread. He said, we'll give a chance. What is there? We don't have anything else. So even widespread malignancies, we will do resection and try to give some sort of a solace. With Satyaprakash, we used to do all sorts of plans. In those days, carcinoma cheek was very, very common. And rotating the flaps was a great thing. You know, we used to do Narayanan's bipolar flap with the patient growing hair inside his mouth. Then Bockhamian flap, very famous those days, how to do a Bockhamian flap, and Mata's flap from behind. And I mean, so many other cases, he'll do the jump graphs from here to there, and everybody will be walking around with the tube hanging. Great times. You know, we used to make fun of all that, but we learned a lot of plastic surgery also. My 3 years in general surgery, I hardly did about 14 months in general surgery. I did about 4 months in anesthesia in 2 stints, 2 months. I did about 6 months in orthopedics and casualty 4 months, cardiothoracic surgery 1 month. Like that, we had to go on rotation. So invariably, we'll be exposed to all different types of surgeries. That was a very good thing. The casualty posting helped me to learn and brush up on my medicine also, because we were casualty medical officers. So managing all sorts of pediatric emergencies, all these fevers, fits, elderly people coming with COPD or whatever, myocardial infarction, typhoid fever. So we learned to treat all conditions. Though we were general surgery PGs, we were exposed to treating all patients. Unless it is absolutely necessary, we will not send a call to the concerned unit on duty, come and see this patient in casualty. Nowadays, the minute the patient comes, the case sheet is just written and put it into the slot. Medicine, pediatrics, no casualty medical officer ever sees the patient. They are missing a lot. When you are sitting as a doctor in the casualty medical officer, you have to take charge of the patient and you have to decide who has to see and why he has to see. Even when I was a Surgeon General Hospital, I used to tell, I never permitted any of my doctors to refer any patient to a higher institution. I say, you can definitely refer, but you have to write. Why? Either some facility is not available here. What facility you have to mention? Because we don't have this facility. Or some expertise is not available. So you have to write, we don't have this expertise to do this. Then you can refer to the appropriate. I don't like sending, this refer to higher institution. Why refer to higher institution? You have to mention why you are referring. What is wrong? Either you don't have the equipment or the necessary facilities. What you have to mention that. What facilities you lack to do this and what expertise you lack to do this. You have to mention that and say. That is the only way. Otherwise passing the buck on is a very easy thing. This is one thing I somehow notice a lot in the present. Of course, too many specialists and super specialists are available nowadays. So why unnecessarily take the risk legally and other things? But one thing is, one is missing out on a lot of learning by doing that. Anyway, after my, I joined as a senior resident in JIPMER. Nobody wanted to be posted in cardiothoracic surgery. I was posted in cardiothoracic surgery. So in cardiothoracic surgery as a senior resident, In those days, we had these rigid scopes only, no fiber optics. I learned the art of doing a lot of bronchoscopies. So I used to visit this ID ward and do a lot of bronchoscopies for all these tuberculosis patients, including pediatrics sometimes. A lot of bronchograms were taken. One instance I forgot to tell you. In those days, we have to accompany the patient and do the special investigation. So one patient we suspected that patient had a CA of the ampulla of water or something like that. No endoscopy was available in those days. So chief said, you go and ask Dr. Srivatsa, who was associate professor in radiology, whether he can do some contrast study to see. Then I read about it, and at that time it was mentioned that one could do hypotonic duodenography by giving buscopan injection and all. So I went to Dr. Srivatsa and said, sir, we want to do a barium. Oh, this is what you are suspecting. Then why don't you open up and see? No, before that we want to be sure. Why don't you? Hey, you cannot in barium meal, you will not see duodenum, man. He told, sir, we can do hypotonic duodenography, sir. Then he looked at me and said, what is Broca's operation? I thought about it. I said, I don't know. You are a surgery PG, you don't know what is Broca's operation. I am a radiologist, associate professor. You are telling me how to do hypotonic duodenography. Anyway, he laughed and he took me and he did hypotonic duodenography. So they were very friendly guys. Why I brought this up, I forgot. It has got a very important lesson for me there, but I forgot what that lesson is. Anyway, I didn't tell this for humor's sake. When I was doing my senior residency in thoracic surgery, there was an opening in Pondicherry State Service for a post of junior specialist in surgery. There was a UPSC advertisement, and in those days, UPSC will pay for your travel up and down, only train fare, nothing else. But anyway, I had some friends in Delhi. I thought I'll take that as an opportunity. So I applied. I was called for the interview. Immediately, Smiles told me, hey, I also went for the interview. I got selected. By the day I got selected, they told me you will be posted in Maghe. So I did not join at all. So be careful. I said, sir, even if I get selected, I am not going to go and join. I just want to go and meet my friends there in Delhi. I am taking this opportunity. So I went and appeared for the interview. It so happened I got selected. 1 week after my return from Delhi, I get a call from UPSC saying that I have been selected. I get a letter. Go and approach the Pondicherry government for your posting. Then I told Smile. Smile said, be careful. If you go, definitely they'll tell, because there were 4 posts, one at Maghe, one at Karaikal, and 2 in Pondicherry. One post was being occupied in Pondicherry by my senior, Dr. KP Singh, another nice gentleman and a fantastic surgeon. So he said, most likely you'll be sent to one of the peripheral places, so you better think about it. So I did not go and approach the Pondicherry government. I got the letter, I just kept quiet and I continued to work. But unfortunately in Pondicherry, Dr. KP Singh was the only surgeon and every day he refused to take a call. So the Pondicherry government approached JIPMER to send one specialist every month to take the calls. So first month, Dr. Chatterjee went, next month, Dr. Ananthakrishnan went, third month, Smiles went. Like that, 4 months were over. Again, the same thing had to be repeated. So somebody had gone and told Dr. Satyaprakash that, sir, this senior resident has got selected. Why is he not joining? Why we should go and look after the calls for Pondicherry State? So I was called by the director, Dean at the time of JIPMER, and said, why are you not joining? I told him, sir, they will post me somewhere I don't want to go. He said, just wait. He rang up to the director of medical services. He told, see, one person has been selected by UPSC. He is working with us. If you promise to post him in Pondicherry, we will relieve him. He said, okay. So that is how I went and joined on the 1st of January 1979 as a junior specialist in Pondicherry service. Come on, man. Somebody ask something. Otherwise, I love to be, it is like a soliloquy. So,
Dr. Bharati would like to come in.
Hello.
Bharati will want to know about my romantic days.
Bharati, sir. Hello, Sulva. Yeah.
Dilip, you didn't tell about your finger injury, man.
Hello.
No, that I had posted in the LDS, so I did not. Anyway,
Okay, okay.
so
Yeah.
see, you can see
After some time.
the length of my middle finger. I have lost.
Hamilton Bailey and then Dilip Baliga.
No, Hamilton Bailey lost his index finger. I lost the middle finger. Now, so I can never be insulting to anybody. So in those days, when I was posted in my rotation in cardiothoracic surgery, a decortication was done by Dr. Sen. And towards the end, he said, just put in a drain. So I had put my right hand inside the thorax, and with the left hand, I just made a nick to put the tube, chest tube. And the tip of that scalpel blade just nicked me in the pulp a little, a few drops of blood came. I didn't bother about it. I just cleaned it with spirit. I forgot about it. Next day, it had turned a little bit dusky and red, and it was slightly paining. I thought probably it got infected. So I took, in those days, ampicillin was the only antibiotic. I started ampicillin. The second day, I found that it was turning a little black at the tip, and the duskiness had extended right up to my terminal crease, between the middle phalanx and the terminal phalanx. It so happened I was on night duty. And luckily for me, I was on night duty in cardiothoracic, and I suddenly find Dr. Sibal there. His father was admitted for some chest problem in the cardiac ward, and it was in the same floor. So he just asked me, how is everything going? I said, sir, this is what happened. Now he looked at me, my God, this is a spreading gangrene of the finger. He took me straight to the theater. He picked up a knife. He chopped off the tip, very close to the tip of the finger. I did not feel any pain. Then he said, I'm going to continue to chop till you feel pain, because we don't want to lose too much of your finger. So he made 3 cuts till I shouted with pain and some bleeding was encountered. He said, okay, now get it dressed, continue your thing. But tomorrow, if it spreads again, you have to show me. Fortunately, it stopped with that. And I had a blunt thing with a raw area there. And after that, Satya Prakash did a cross finger flap. So I was going around for 3 weeks like this with a flap attached. And after that, it went on well. No problem. It has healed well. I have been able to do all the surgery. So this is a story about my missing tip of the middle finger.
Bharati, would you like to come in?
No, that is what I was wondering. Why he has not this told us. They were all memorable days. That was the golden era of the surgical department. All the chiefs, he is mentioning Dr. Sen. What a great teacher he used to be.
I will tell you, Dr. Sen, another fantastic story.
He will teach us, sir. Dr. Sen will show the first clinical year a case of something in the OP. Then he will call them to the theater. What surgery is done? He'll show them the specimen. Oh, what a great teacher Dr. Sen was, sir.
And he was a true general surgeon. If whenever there is some problem in any department where the chief is not there, he used to be posted. That's how he got posted to cardiothoracic surgery. He didn't stop. Straight away, he started doing mitral valvotomies, PDL ligations, everything he used to do. In fact, even today, I am quite confident of doing a closed mitral valvotomy. I assisted him in so many mitral valvotomies. Today, I am confident that I can do a closed mitral valvotomy. What happened was, we had one case of CA esophagus, only barium, no endoscopy those days. The barium showed lower end, towards the end, lower end esophageal growth. So he said, okay, we'll do esophageal gastrectomy. He was very busy that day. Dr. Subbarao was the registrar. I was the surgery PG. He said, open the abdomen and make a stomach tube. And he walked out. He was called for a meeting in director's room. We opened the stomach and we did a stomach tube. He told, just put the clamp to the end of the stomach tube and leave it inside and close the abdomen, I will come. He went out again. He came back. Then he opened the thorax. By the time we shifted and all that, it was already about 4 hours were over. He opened the thorax. Unfortunately, the serosal aspect of the esophagus was started with malignant nodule. So he went on dissecting, and by the time he found a normal esophagus, it was right under the aorta. He cut it off there. He removed the esophagus, everything. Then he said, now let us pull up the stomach tube. The stomach tube he pulled up. He could not anastomose inside the thorax between the esophagus, the proximal esophagus and the stomach tube. There was a gap of about 1 inch. He said, you people have not done a proper long stomach tube. We didn't anticipate because we thought it was only a small. What he did was he brought out the stomach tube in the second intercostal space and made it into a gastrostomy here in the second intercostal space. Then we closed the chest. He put it again. I thought operation was over. No, we have to do a cervical pharyngostomy. Otherwise, whatever he swallows will fall into the. So he did again one cervical pharyngostomy here. So there is one cervical pharyngostomy here, and 1 inch below there is a gastrostomy. Then he said, we will devise a tube with a muscle and skin tube and attach these two at a later date. So his name was Pannir Selvam. We used to call him Kannir Selvam. Till I left my posting there, he used to, he used to have a small bag here. Then he used to feed himself through this with a gastrostomy tube. That all adventurous surgeries. Nowadays, you can't even think of those surgeries. So I joined, when I joined Pondicherry, it was on January 1st. There was only Dr. K.P. Singh. He was chief of Unit 2. So I had to naturally take up Unit 1, but the Unit 1 chief was on long leave. He was from England, one Dr. Zucchi, and he was a senior specialist. There was only one post of senior specialist, and he was on leave. So I went and reported to Singh, and Singh looked at me and said, Baliga, what we'll do is we will talk to each other. We will not talk about each other. I like that. That's the first thing he said. When I met Dr. Singh, he said, whatever problem, let us talk to each other. Let us not talk about each other. We followed that principle.
Sir, if I can interrupt you for a minute.
Yeah.
When we were finishing MBBS, there's a thing of PLAB, there's a thing of MLE, and everybody is, either working towards MLE or PLAB. That option wasn't there when you were.
Fantastic. Almost all my classmates went and wrote.
Why didn't you?
Raj Kishore Bag. I was married, man.
So
what else? I had the great. I was married, so I did not have that option because it involved money. One, because at that time, just in that close to Colombo. Previously, you could write ECFMG in Colombo, so we had to go to Singapore. So my friend Kumaran here, he has cleared his ECFMG, Rajkishore Bagdi. So many of the people who did not get into PG, and some of them who got PG also, after finishing the PG, they went. But many of us stayed behind. And passing MS used to be a very tough thing. Nobody passed. 7 attempt, 8 attempt were very, very common. Like when Smiles was talking, he said about a brilliant senior of his, Muralidhar. He was the first fellow to pass MS from JIPMER in second attempt.
Okay.
He himself and Dr. John Periyanayaka. They passed in the second attempt, and we celebrated it as if it was some Diwali or Pongal in Harvey House. Because somebody could pass in second attempt was news to us. Then the person who passed in the first attempt from JIPMER is Rajkishore Bagdi.
Okay.
Rajkishore Bagdi is my classmate, but because I had failed, he joined MS 1 year earlier itself. And he gave us a lot of enthusiasm that it was possible to pass in first attempt.
Sir, why is Dr. Bharati interested in your affairs and your premarital?
No, because she used to see me all the time in Curie House. After 6 o'clock, my time was spent only in the Curie House, in the common hall, or sitting on the steps of the Curie House. And I used to, after 9 o'clock, the phone will be occupied by me. I would have rung up from the Lister House, and the phone, my girlfriend will be on the phone on the other side, and we'll be talking till 12 o'clock. So nobody.
The girlfriend and wife are the same or different?
Yeah, always. Yeah, I told you, no. Anything I like, I cannot give up. My cigarette and my girl. So it's two things I can't give up. So it so happened. So all the girls, some of them went and complained to the warden and all that, that the phone is getting occupied by one particular person for hours together. So teaching, I come teaching.
The KP Singh.
I must recognize here great contribution of Dr. Anantakrishna. He came in when I was in my final year, towards the end, practically towards the end. I had about 6 months before I could appear for the examination. He had come in. And he was very enthusiastic. He was a bachelor, so he was also staying in the hostel. He used to take clinics. And they were great clinics for the PGs in the evenings after 7 o'clock. But none of them I could attend because by 5 o'clock I have to go back to my house, which was about 5 kilometers away. And I had a daughter by then. I couldn't miss her. So Bagdi and all will come, and some Bagdi would visit me in my house on Sundays, and they'll play with my daughter. They'll say, Baliga, you're missing Dilip, you're missing this fantastic classes he's taking. A lot of theory, he'll read up the letters, and and he brought in a structured training program, how a person should learn, how to write thesis, all these things. Otherwise, in those days, thesis used to be just, but because of him, a structured learning and teaching, everything came into JIPMER. As he became senior, he brought it in. That is why you all benefited because of that. In our days, there was nothing called teaching. We used to just follow the chief, do the work and learn, as I said. Not that I missed that, but it didn't have a structure. It didn't give confidence in any of us that we are going to pass. We knew we will definitely make good surgeons. We have learned what has to be learned. But whether we'll pass this university examination, we never had it. But to my great surprise, what happened was I appeared for the final year. 3 days it was the examination. Out of 6 of us, one had skipped the exam. He didn't want to come. Only 5 of us. Myself, Dr. Jagdish, Unnikrishnan Menon, now who is a famous plastic surgeon. Then one Lokur Viraj, is a urologist in Miraj. And Varadarajan, who is in UK. So I was the first candidate. In those days, the examiners will sit and they will keep the cases here, only 2 at a time. All people cannot examine. 2 people will be called. Short cases, one fellow will examine. Long cases, other fellow will examine. They will just sit here and observe what you are doing, and they'll be making notes. Once they be finished, we go out, they change the cases, next two. So by the time, though it started at 8 o'clock, I had finished by about 9 o'clock and gone out. But I was called again for 12 o'clock for the viva, like interview, to discuss the case. On that day, something happened. I was like, our Rahul Dravid in one of those blitzkrieg you never expect, One day he scored 100 runs in 60 balls or something like that. Whatever they asked, I was really blasting it away. And Dr. Anantakrishnan was just help for the examiners. He was standing there, and so after, he never had any good opinion about me because he has not had any personal exposure to what I do. He knows this fellow is a smoker and just loitering around in the verandas and scoots by the time it is 5 o'clock in the evening. But he came to me. I finished at about 2 o'clock in the afternoon. He came to me and said, "You have done extremely well. I'm sure you're going to pass." The other guys who were waiting for it to go, they were all flabbergasted. Evening, of course, we had all these instruments and all that at about 5:30. Then night, after that I went home. I took my wife to Aristo for dinner because I had finished the examination. There, I find the examiners were there. They are also having dinner there. Dr. Sibal walked up to me and congratulated me and said, "You have passed." It was a great one. I felt I was in heaven.
The first attempt.
Yeah, first attempt. So, and all of us passed. All 5 of us passed. Whoever appeared on the first day. But next day, everybody failed. They were all repeaters. Not that they were any inferior to us in knowledge or technique. They were fantastic guys. But it so happened. These exams don't take it very seriously. It is your just sheer luck.
So that time, was there any concept of super specialization? You worked in cardiothoracic. Didn't that cardiothoracic surgery pull you to its side?
No. No, what happened was, I was 100% sure that I am going to fail. And once I fail, I don't have a job. You see, So just about 2 months earlier to our examination, I had applied and got my GMC registration. In those days, everybody wanted to go to UK. If you really want, seriously, Lakshmi Ratan had gone, Balakrishna Warrior had gone, Kolasa had gone. All these steps were my seniors or registrars who couldn't clear their exam. MS, third attempt, fourth attempt. After that, registrar post also over. So they all migrated to UK. So I had got myself registered and I got a posting also as a senior houseman. And in those days, a princely sum of 175 pounds sterling was offered. But everybody told me that will not be sufficient to run a family. But anyway, wife also could get a job. I was planning like that. Let us go to England. The day I passed, I said, no, I am not going for this salary. Let them take me as a registrar. So I wrote to them saying that I have cleared my MS from Madras University and from a prestigious institution like JIPMER. I thought the whole world will recognize the fact that I passed in first attempt and give me. So I said, take me up as a registrar, which was about 350 pounds in those days, I think, that I am willing to join. They said, no, our policy is you have to first work as senior houseman for some time. We will assess you, then only you may be taken in as. By that time, I had already got my specialist post. So I joined. That's all. Super specialist, Bhagdi went to super specialty immediately after finishing. He went and joined the pediatric surgery was coming in at that time. But
so what is the secret of your doing so well in the exam? You've never been a great student. That's what we are. You never attended the evening classes of Dr. Anandakrishnan. Where did you train yourself? Where did you learn? And what is the secret?
That's what I told you. No, I absorb a lot of things. I absorb a lot of things naturally. I told you when we sit together and talk, many people think that at that age we'll be talking about movies or girls and things like that. No. We were talking about the patients. There'll be a lot of mirth in it and what could have been done. We'll make some joke about our professors, how they mishandled it and what could have been done. Things like that. It's all in lighter vein. But the inputs one gets from 10 different fellows, and they're not morons, you know, and they'll come, some of them are very well read. They will pick up something which we have missed. Okay. I now remember about the Srivatsava incident. Why I mentioned that is, we did a hypotonic duodenography. He only told me that the whole of the duodenum and the first 10 inches of the jejunum, they contract as a whole. They contract as a whole. There is no peristalsis in the duodenum. That is why you are not able to catch in your barium meal, because the whole of the duodenum will contract as a whole. So where will you catch the picture? You cannot catch a picture. That is why we are doing always a GJ as close to the DJ flexure as possible, because it has to be within that fully contractile loop. If you exceed that length, you are going to have an afferent loop obstruction. This is the basis behind it. How many of them know? We all have read our physiology, but it required a radiologist to tell me that. This is how I remember. And when I express this in examinations, even some of the examiners will be flabbergasted. It is not in the book. Book, everything is written, but what is important, what is not, we don't know at that age. With a lot of working experience, we get it. But when already experienced fellows are telling that, you better take it. And remember it. That is how I do well in the examinations. I'm very clear about those things. So,
how was your operative surgery by that time? How good were you? You can manage cases independently by the time you finished your.
Of course. Absolutely no
And
doubt.
the grade goes to
I definitely to the JIPMER training. We were trained like anything, you know, by that time, and not only by our seniors. There are instances where, you know, the anesthesia registrar, one registrar was there called Seshagiri Rao. He was a registrar in anesthesia, but a fantastic surgeon. And usually, you know, all these fistula piles will be at the end of the list. By the time all the chiefs would have left, the anesthetist chief would have told, we are closing down the OT. But once he goes, we would have begged the registrar and the anesthesia, he'll be giving a spinal and we'll have to finish up fast. So one table, somebody will be doing a fistula, another, this table will be doing piles. So there is no guidance there. You have seen one, do one and guide another fellow. And we run into problem, Seshagiri Rao will come. Similarly, in night emergencies, if Seshagiri Rao is there, even chiefs will not come. He was anesthesia registrar. So, see, to become a general surgeon with confidence, what? In elective, one has to do all these pipe fistula, hernia repairs, GJ vagotomy, which was very, very common those days, mastectomy, if you want to be, thyroid, prostate, all these things we have already done as PGs independently. And emergencies, you open up intestinal obstruction, you go to the collapsed loop, you find out the dilated loop, collapsed loop junction, what is causing the problem. If you can resect it, you resect it, or you divert it. What is the problem? So there was a tremendous confidence in managing. I never had any problem. When I joined as a specialist, I was 27-year-old, and I was having an independent unit. And the assistant surgeons were 3 under me. They were all nearly 10 to 15 years elder to me and my seniors in college. I'll tell you one very good instance. Within 10 days of my joining as a specialist in Pondicherry, in those days there were no telephones. Nobody can get a telephone. You have to wait for about 2 years or something like that. So an ambulance from hospital will come with a call book. I came to the call book. My senior, about 6 or 7 years senior to me, one Dr. Subramaniam. He has been working as assistant surgeon in the GH much longer there, and he was the assistant surgeon on duty. He sent me a call. There is a case of perforated duodenal ulcer. Please come. And the X-ray is attached. There is gas under the diaphragm. But the vehicle did not enter through the main gate. It went to the back gate where usually the dead bodies will be taken out. That it was dark, nobody there. And Dr. Subramaniam was waiting for me. There is a side entrance to the old OT from there, in our OT. He just talked about the patient. I already shifted. Anesthesia person is there. We are waiting only for you. He took me inside. I went and I did the perforation closure. Came out. Then he told me, why I brought you this way. This patient apparently has got married only the previous day. It is some Tindivanam or something. He is the groom. The same night he has perforated. In Tindivanam, they have taken an X-ray, they have referred to JIPMER. But instead of going to JIPMER, the whole Jingbang lot, both parties, groom party, bride party, they have brought him to GH. They told in JIPMER students will be, learning doctors will be operating. Somebody told them in GH only the qualified people will be operating, so you better go because he should not die as a groom. So then they were satisfied to see me. Who? Siva Subramaniam. When I told them, my chief will come and operate, don't worry. I have given the confidence. But if they have a look at you, they will lose confidence. So I don't want them to see you. Who is doing the operation? So when I went to Karaikal, I took it to my heart and I had to look really senior. So I always used to walk around with a pipe, a long white coat, always wore a tie. When I went to Karaikal, I always wore a tie. I was still 27, 28 years old. But people thought this fellow is some very senior person. I always had a pipe like a Chaudhary in my mouth, smoking and taking rounds and all that. I was putting up a big show to gain the confidence of the people. Otherwise, looking at me, nobody will subject themselves to surgery for me. But it was a fantastic experience in Karaikal. See, when I joined in January 1st, on January 26th, within 4 months, there was a big galata in Pondicherry because Pondicherry Union Territory was to be merged with Tamil Nadu. Moraji Desai was the prime minister then. The army was deployed. They had made a full curfew. The Pondicherry police were asked to be, secluded to their barracks. The whole town was taken over by the military. On 26th morning, the flag hoisting was to be done by the governor. There was a big crowd rioting, everything, telephone lines were cut. There was firing. Fortunately for me, because it was Republic Day, I had gone to the hospital at 7 o'clock itself. Not many turned up, but by 8 o'clock, the hospital gates were closed by the military people on the road. They said nobody is allowed in or out, and they started bringing in people who were shot. By 8:30, we are having about 8, 9, 10 people brought in. So that is where I learned the triage. For the first time in my life, I am seeing gunshot injuries. And luckily for me, the people who had serious injuries were dead by the time they were brought in. One fellow I had in the chest. He is a policeman's brother. So I took him. I did a thoracotomy, removed the thing, and put in a drain. By the time I came, most of the other things were in the limbs. They were all 303 bullets, this long bullets. the old Lee Enfield rifle. Then all those things, and the ketamine anesthesia we did. One chap had one small injury here and he was bleeding. I had just left him. He was otherwise looking normal. But I had sent him for X-ray. The X-ray came. It was showing a bullet here. And by that time, that fellow was showing signs of cerebral compression. So I did burrows, removed that bullet, and did debriding a little bit and all that, cleaned up the area and closed it. Of course, he had a hemiplegia which recovered after nearly 5-6 years. Slowly only it recovered. He was provided a government job also afterwards. That's a different issue. But the people who were brought in, we didn't lose a single fellow. After 2 or 3 days, all these fellows were there in the post-operative ward. Suddenly the governor, the chief secretary, the chief minister, everybody came visiting them with the press. In those days, there were no videographer and things like that, the press. And they had brought covers. The government had sanctioned some money for each of the people who got injured. So they already knew that these people were coming. So this one fellow told, he was looking like a union leader. He told, if anybody accepts the money, I am going to kill you when I come outside. They shoot us and now they want to come and give money. Not a single fellow should accept. One of the patients he had told, all the people obeyed. These people came, they went on giving money, had to go. They said, no, Vana. They didn't even talk. When they came to this union leader, the fellow openly said, what you are joking? You people want to kill us, you shoot us. Now you come and give us money. If you at all you want to give us money, give it to this doctor. He saved our lives. Finished for me. In government service, I learned that if people keep complaining about you to your minister or to your secretary or to your director, they will take your side and say, oh, in service like that, you would have misunderstood, they're overworked and all that. What they cannot tolerate is somebody telling that fellow is doing a good job. Immediately they take it as a personal insult, whether it is being implied that they are not doing their good job, only this fellow is doing, so they will take it out on you. Within 3 months, I was transferred to Karaikal. Anyway, it was okay. I went to Karaikal.
When you joined the unit, there are assistants who are senior to you.
Yeah, naturally.
But
they
how
did
could you
not
manage them? Don't they have any issues with you?
No, I was like a friend. They could call me Dilip. I never minded.
Okay.
Yeah, they have been calling me Dilip in college. Why can't they call me Dilip here? As long as they do the work, that's fine. Lingeshwaran was my assistant. I don't know how many. So Subramaniam was my assistant.
But they were your seniors in college.
Yeah, definitely. Definitely.
Okay. So what was the protocol you followed in dealing with them, with not hurting their egos?
No, it will not hurt them because we all used to sit in the OPD and do how. See, did it hurt Dr. Chowdhury's feeling? We were all together. We moved like that. I never changed my pattern of working. But what should be done, it has to be done. That they also knew that. They were responsible people. They were all from JIPMER. They knew what has to be done. No problem at all. I had problem only later on. When newer batches started coming, nearly 20 years later, especially from JIPMER, I will say any day, please give me somebody from Tanjavur Medical College. If that fellow doesn't know, he'll say, sir, enakku theriyadu how to do it. Suppose if I on phone, if I tell him, why don't you put a chest tube for that fellow? Sir, enakku theriyadu na pannadilla. Sorry, come. Then I know. But if it's somebody from JIPMER, not all, somebody from JIPMER, it's very difficult. He will neither tell that he cannot do it, nor he will do it, but he will tell my nurses that it should not be done. I don't know why chief is telling this is not the correct procedure for this patient. So this sort of, he will give a big explanation why a chest tube should not be inserted in a particular patient. So I had difficulty only 20 years down the line, handling my assistants. Not when I was young. There was no problem with that at all.
So how was life in Karaikal?
Oh, there was nothing, not much life. Because it used to be a quaint seaside town with, steeped in, probably it was in the early 20th century. Early 20th century.
Dilip? No.
Yeah.
See, what I have learned, I've heard. See, when you were there in charge of Pondicherry Health Service,
yeah,
that was a time when people used to say that Pondicherry Health Service is better than JIPMER. So I want to listen to those stories. How you took Pondicherry Health Service to such great heights.
No. See,
I
you
remember when we had a conference, you were the chief guest and gave a wonderful speech. But that was the time when Dilip Baliga, director of Pondicherry Health Services, there was even a talk facilities in Pondicherry government are better than JIPMER. You know, that was the time at that time.
no, see, you can see farther when you are standing on the shoulders of a giant, like that. Dr. K.P. Singh in 1984 itself, he had got the endoscope, fiber optic endoscope, which was introduced just then, hardly about 4 or 5 years earlier in India. Olympus X30, I remember. And it was in the surgery department. When I joined, came back from Karaikal, he trained me how to do endoscopy. At the time itself, within next 1 or 2 years, we started doing side viewing endoscopy. When it came, we procured the side viewing endoscope. We procured the colonoscope. We used to do polypectomies. We used to do foreign body removals. Similarly, when the banding came, we were the first to buy the band. It has got a big legacy. When I was chief of surgery, I liberalized the endoscopy policy extensively because we were getting a lot of carcinoma stomach operating. So I said, let us catch them early. So I liberalized the endoscopy policy. Anybody with a 2 months history of any dyspepsia, I said, do an endoscopy anyway. But what I learned after nearly 3-4 years, at times we used to do nearly 25 to 30 scopies a day in GH, upper GI endoscopies. But we did not find any early cancer. Whomever we clinically suspected because of a mass or something only we found. But unsuspected CA stomach, we never found. That made me realize that a liberalized endoscopic policy in the South India at least will not translate into a early detection of cancer of the stomach. That is my view. Anyway, so when I took over, I said, okay, let us modernize it. We got the CT scan, we got the MRI, we were the first to introduce all the staplers and mesh plasty for all patients. We don't charge anybody. All meshes we got. Similarly, when the laparoscope was introduced, we got 2 sets of laparoscope, all good quality, stores. Then when we encountered all this port site infection, we got a plasma sterilizer. And when you remember, Raj, every year we used to conduct a theme-based workshop for 2 days. A theme-based workshop. When we did the carcinoma breast workshop, I got from Singapore the handheld gamma probe and self-trained myself how to do a sentinel node biopsy using a handheld gamma probe. Luckily for us, we had by that time our division where we could get the technetium and all that. So it was a great experience. It just built up over the time. I had fantastic support of the politicians as well as the administrators, and the surgery department at that time was very much committed. Assistant, lab help, everything we had. I think we are exceeding our time, Patta.
No. We have half an hour more, sir. We can have a cup of coffee as we go on.
Yeah. I think
now, how did you update your what we understood is that the boss cannot do laparoscopy, others shouldn't.
What?
If the boss cannot do laparoscopy, the rest shouldn't.
No. In fact, all my assistants were doing left, right, and center. In fact, Dr. Venkatesh, Dr. Shabir, they were all fond of doing. So what happened was, any new innovation they wanted to, I stopped only with doing cholecystectomies and no, I'll come. So that is, they were all doing extraperitoneal mesh repair, and of course we were doing a lot of diagnostic laparoscopy. We started doing liver resection, and we had become by that time high volume center for CA esophagectomies and pancreatic surgery. So that is how it developed over a period of time. It's not a one-day story. It is from I took over as head of the department in 1992. By the time I took over administrative position in 2004, we had by that time established almost the whole full-fledged surgery center. The learning experience started developing because we were granted the DNB in surgery. 2 seats every year, and 1 seat in pediatric surgery. Even till date, our candidate is the only candidate who passed the 5-year direct pediatric surgery in the first shot in the history of DNB. He was the only candidate who passed the 5-year DNB program in pediatric surgery. Dr. Lala is there now as a super specialist in Hyderabad. We had a fantastic result. Almost 50 to 60% of our DNBs are all first time, direct first time pass. Others all second time. We don't have chronic additionals in DNB in surgery. That's why GH Pondicherry used to be selected by all this. Anybody who gets high ranks in entrance examination will select GH Pondicherry. It's a good center. Even today, our GH surgery department is an excellent center for training.
Could you start a medical college in Pondicherry?
Yeah, that was, when I was medical superintendent of that prestigious institution, General Hospital Pondicherry, which is more than 200 years old. I'm very proud of that institution. They had just decided to start. Land was acquired. By the time I became the director, we acquired that land. We put the foundation stone. It helped because I was by the time member of the Medical Council of India. I had to do a lot of compromises on my principles anyway, and get the permissions granted to start that medical college. And by the time I left, we put in the first batch of students in Pondicherry Medical College.
Dr. Angelin is mentioning that in spite of you being the administrator, whenever required, you used to come to the OT in the middle of the night.
No, yeah. I will come. If any chief is on leave, I used to take the call for them. I enjoy. I tell him, I enjoy that journey. Even today, I go and operate. If somebody calls for my help, I don't hesitate. Anytime I get a call, I say, okay, I'm willing to come. I am as happy doing a sebaceous cyst excision or a circumcision as I am doing Whipple's operation. It makes me happy to do surgery. I enjoy my work.
But you look so fit at whatever stage. The cigarette, the credit will go to the cigarettes or the booze?
Both. Equal partners.
What is the secret, sir?
Secret is I enjoy my life. Very simple. I am happy
What
all
do
the
you
time.
mean by that?
Yeah, I am happy to be alive. 1, I never crib. Number 2, I take everything easy. Number 3, I have no regrets. And most importantly, from morning till evening, I forgive myself. I don't feel that, I never feel guilty. I say, okay, Santa, it happens. It's not my fault. I leave everything to, Krishna Arpana. I say, if I have done something wrong, it is Krishna who has done it. Why should I feel sad? If I done something great also, it is Krishna has done. I don't feel sad. But I enjoy it. I enjoy doing the work. That is what keeps me healthy and happy. Not that I don't follow any regimen. I enjoy my whiskey. I smoke nearly 30 to 40 cigarettes a day for the last 40 years.
Even today?
Yeah, even today. Even today. Probably this is the longest period I have not smoked.
Okay. And how spiritual are you? Not the spirit I'm talking, but spiritual.
No, I am agnostic. I don't believe in any particular God. I just feel, I definitely feel that we are very insignificant. Cosmos is infinite, infinite. And Earth itself is like a particle in which we are nothing. And it is the cosmos which has got its own logic, its own intelligence, its own consciousness. It's running through us. A part of it is in us. And it is taking care of it. Just like your human cell in your body. Can it decide? Or it may think whatever it wants to do, but ultimately it has to go by the physiology, whatever dictates of the body. Like that, we are being guided. I have become that sort of, everything happens for a purpose and everything is done according to a supreme will of the cosmos. Our ego makes us feel that we are probably doing it. Somebody said a roaring river thinks it is flowing as it wants, but only the banks know. The banks are already there. The river can make whatever noise, but it can flow only in between the banks. Like that, we may make whatever noise, but our lives are already, the banks have been made. We can only flow there. So there is no point blaming anybody or taking pride in whatever you have done or feeling sorry for anything. I got that sort of philosophical view. Whether it is spiritual or not, I don't know. But it makes me happy. I enjoy jokes. I enjoy company with Kumaran and my friends. I am missing him because he brings one of the best boozes. All premium scotch he brings.
Okay. When should a surgeon retire?
Okay.
At death. At death.
Nice to hear that, sir. Now, what are your regrets in life?
Frankly, I have no regrets. I have no regrets. I told you, no, what is there to regret? Regret comes only when you have a goal. I have never had any goals. I have never had any goals. I married the girl I wanted. I am happy with the work I am doing. I feel I am privileged. In fact, I used to tell my wife that she used to tell, why you are not coming to temple? Why not? I say, God will get angry with me. My cup brimmeth over. So why would I want to go? Because he might think, I have given everything, why this fellow is again coming here? So let him grant wishes to others who want it. They're coming and standing there in line. I am very happy where I am.
If born again, what will you be?
I will have to tell you the Narada story.
Yes.
You know the Narada story?
Narada. There are
Narada.
many stories.
Yeah, no, this story is very important. It's my favorite story. Narada is a stickler for purity and, bathes every time, fresh flowers. And he is fond of telling Narayana, Narayana, biggest sycophant of Narayana, to the irritation of Lakshmi. Because she doesn't allow a single minute of privacy with Vishnu. This fellow, and it so happened Durvasa curses him to become a pig. This fellow comes running to Vishnu. Vishnu says, I can't do anything. But why are you worried? I will give you a solution. You be born as a pig. The next moment you say Narayana, I will come and give you the grant, a wish. You come back as Narayana. What is there? I cannot undo what Durvasa is. So he is born a pig. Narayana is waiting for the pig to call him. 1 day, 2 day, 1 month, 2 months, no Narayana. So he goes there, looking at with Lakshmi. There they see one big fat pig. He's having 3-4 sows, having fantastic time with them. Some lot of piglets are running around. In the shit pit, he is lying down and eating all sorts of things. Vishnu is flabbergasted. This is Narada, such a man for purity. He is in dirty shit and sleeping with 3 or 4 sows and doing all this. And the pig is looking at Narayana, but still, not calling Narayana. Lakshmi was making fun of Vishnu. You were so fond of this fellow. Look at him. He is not even, once he's a pig, he doesn't even recognize you. Narayana gets very angry. He sends a big flood. The flood comes and it carries away all the piglets. Now the pig is running here and there, trying to save the piglets from drowning. His sows he is trying to protect, but the flood is coming. Then he looks and says, Narayana, where are you? Suddenly Vishnu comes. Hey Narada, what has happened to you? Why are you doing this? Don't you know you're Narada? And your piglets are getting swept away, you remember me. He says, all the time I know I am Narada. When I was Narada, that time it was my nature to wear clean things. It was natural for me to have flowers and go on telling Narayana, Narayana. But when I was born as a pig, it is natural for me to screw the sows and have a lot of piglets and roll in the mud. This is Antiki Adasuka, Intiki Ite Suga. That is what he tells. So it is. So in the next birth, whatever I am born as, I am going to enjoy that life. Because I am born that, I will find happiness in that life. I am not going to ask for any life, different life. Whichever life is given to me, I am going to enjoy it.
We can see that, sir. If we'll open it for any comments and questions and reminiscence of
Patta sir,
you put your camera on, Prabhu. Put your camera on if you are presentable. That is.
Can I ask a question?
Yeah.
Sure.
Sir, I have seen you as a house agent in 2004. You're an excellent teacher, but you suddenly turned towards administrative post. I remember I was a house agent to Ashok Swaminathan and Kapil sir also. So you suddenly take a turn towards administrative side. Did you take it as a interest, or you suddenly turned your thing towards administration?
Are you forced into?
No, no, it is in a way posted. First is the Dr. Subramaniam Reddy, who was the physician and chief of medicine, was offered the director's post in 2003 or 4, I think 4. He was the medical superintendent of General Hospital at that time. The only condition he made was to take up that position was that I should be made the medical superintendent of the hospital, because he said for the director of health services of Pondicherry State, the biggest problem will be General Hospital. If he doesn't have a capable person there, he is going to have a lot of flack. So he wanted Dr. Baliga to be medical superintendent. That is how I was posted in. I refused, and he came and told me that unless you take up, I am not going to become director. I don't want to take up director's post unless you become medical superintendent here. I don't want headache from this side. So that's how I took up medical superintendent post, thinking, okay, it's fine because I am all the time in the hospital. I could take care of my department also, and administrative work, it's okay. But once next year he retired. When Dr. Reddy retired, the honorable minister called me and said, okay, now you have to take up as director. I gave him all my explanations why I cannot be and things like that. Then he said, nothing doing, you please take up, you can do your surgery, you can do everything. And I had a good team of people, administrators. They had posted a professional administrator under me as a officer on special duty. I had a very experienced senior finance officer. So that was not a problem. My job was only giving them directions and to make planning for the next 50 years, how the department should develop. That was the planning I given. So there was not much of a job. In fact, as a director, I used to come and operate. I was running the unit.
Sir, Dr. Kumaran has not spoken.
You want me to talk? Can you hear me?
Yeah,
Yes,
yeah.
Yeah. What is there to talk about? My closest friend, my cousin-in-law, I should say. What do you say? We've been almost associated for the past 53 years now. Huh? Nothing to regret about. Only thing I miss him. I've not met him for the past. Otherwise, every month we used to meet, as he said, we have a small get together in Pondi or so,
what is one thing you like in him so much?
one thing is, like me, is carefree. Number two is always jovial. He can take any insult and also any praise in an appropriate way. And as he said, he's carefree. He enjoys life. Okay, that's one thing I like about him. And of course, he's got a beautiful family. My sister and his son is like the closest friend of my son, and his daughter also closest friend of my daughter. No, we have been together like that for the past month. And I think Raj Kishore is there on the line. We'd like to say something, Raj. Raj?
Yeah.
Come on, Raj. He's far away from Bombay. He's talking.
No. In our batch, Dilip was the youngest and the wittiest, and he is responsible for all of us getting together by starting our batch 67 WhatsApp group, and he organized so beautifully our 50 years batch meet. So actually, Dilip has shot into fame more, I would say, in this Pondicherry. He has shown his excellent, apart from being an excellent surgeon, he has really shown very well as an administrator in this Pondicherry government service. And I think this beautiful Women and Children's Hospital also was built in your time only.
Yeah.
I heard, about JIPMER and all of us know, but I really heard a lot about your administrative skills and the way you taken Pondicherry government. How is it after you left? The same thing continues or must have?
No, I don't keep much in touch, Raj. Once I left, I leave it because I always hated the tendency of somebody poking in and unasked for advice and all that. I don't like to give. If I am asked, I will get.
What has Kapil got to do to say about his dad in a few words?
Kapil has left. He has
Kapil is here. If you can put your camera on and come up and say a few things about your dad, which you never told him on his face.
he has told a lot of things on my face. I'll tell you, when he was studying for final year and he was a very tense, irritable person. when he's studying. So I told him, what is there, man? In our days, it's all very easy. You just go relax and you'll write the exam. He said, Ma, ask him to keep quiet. You would have read cardiology in your days. You would have read, it is now believed heart has got 4 chambers. That is all the cardiology you read. Now I have to read this much. In your days, it would have been only that much, 2 pages in cardiology. Now it is believed that the heart has got 4 chambers. That is all you would have read about cardiology. Like that. Even this afternoon, he was telling me that Dad doesn't, for him, any disease can be treated by taking rest.
So, what is the secret of physical fitness, sir?
Physical fitness. Now, of late, I get up early. Always, I get up early. I go for a walk. And my daughter has presented me 2 dumbbells, made out of sand and covered in canvas. I do all exercises for the arms. After that, I do breathing exercises for about 40 minutes every day. Before that, I would have had 2 cigarettes. After the exercise, I do 1 more cigarette. Then my breakfast. That is fine. No other thing.
Bharti, about your time with Dr. Baliga?
I knew him as in college, during college days as a student, and then when I was a house surgeon and he was doing his PG. You were in Satyakumar's unit, right, Dilip?
No, Sibal and Chaudhary.
I didn't actually. I was posted in Satyakumar's unit as a house surgeon. So, I mean, I had more interactions with Revati than with Dilip actually.
Yeah.
So Dilip, tell us how you were a very busy surgeon, and I know Revati was busy with obstetrics. How did you manage home life with the children and all? You have a daughter and a son.
Yeah.
I've met your daughter, but not your son.
We somehow found time, Bharati. Of course, it was a little difficult when they were preschool. That time it was a little difficult. After that, once they started going to school, by the time, Pondicherry's service is fantastic in that way. We go out at 8. By the time the children would have left for school, and we'll be back by 2:30. After that, we are free, unless you are on call. And both of us, by the time, we are specialists. So we need to be on stay duty. It's only a call duty. So we had plenty of time to really attend to the children. So then by the time they came back from school, parents were there at home. And Revati was a very strict parent. I should I owe her a lot. She has brought up the children well. Both my children done their schooling here in Pondicherry, and they entered JIPMER. Daughter, of course, is in the US. Son has become a vascular surgeon. My daughter-in-law also is from JIPMER. So there is a big joke. When my daughter was going to UK to do her surgical training, she applied for her visa. In the Madras visa office, they asked the question, what is your father doing? She said, my father is the doctor. Oh, what is he? She said, he's a surgeon. What is your mother? She's a doctor. She's a doctor, yes. You have any siblings? She said, yes, I have a brother. What is he doing? She said, he is doing his MBBS. Hey, what about the family dog? She asked. She said, no, that's the only disappointment, joined foreign service. So he gave a big laugh. He called everybody in the other officers in the British consulate, and they really enjoyed that joke. Look at this, it's a family of doctors, and only the dog is a disappointment, wants to join foreign service. She got her visa and went to UK. After that, after training there, she went to US.
Dr. Chandrasekhar, T.S. Chandrasekhar is joining in.
Hello.
Yeah, Kapil, you want to say something?
Kapil is silent. I think he is in his clinic where actually the data doesn't work.
Okay. Professor Chandrasekhar, T.S. Chandrasekhar. Sir? So we have another 5 more minutes, sir. And then if anyone else wants to comment or, say something. Ravichandran?
What happened to Mohan Krishna? He was there. He was all the way from US.
Jai Shri is also there.
Yeah.
Oh, Jai Shri is there. Look,
Yeah, Lalatendu.
Sir, good evening, sir.
Good evening. Lalatendu is the
Hello, Lalu.
yeah, he is
Hello,
the
sir.
candidate who cleared in first shot 5-year
Thank you, sir.
pediatric surgery. DNB.
Thank you, sir. Thank you for remembering.
Yeah.
It was very nice stay at Pondicherry.
Yes.
In fact, I enjoyed more with Baliga sir than my home department. Whatever I have learned, the tricks in surgery, it is from sir only, and I owe him everything. He's a thorough gentleman and very. For my marriage also, he was only responsible. He was my fatherly person, sir. That's all I can tell.
Wonderful, wonderful.
Nice to see you, Lala.
Thank you, sir.
Sir, on that note, it's I think we should have one more session, to have something more coming from you. And
No, but what I say is after the corona is over, if you want an enjoyable session, come over to Pondi.
Okay.
We'll have a spiritual session. That is more enjoyable.
Sir, we are also invited.
Yeah. Anybody, we'll fix a date.
Spiritual session, I want to join also.
Yeah. I can. Then you will hear the pearls of wisdom from me.
Okay,
Certainly.
great.
Unless there is, my engine doesn't work if there is no good lubrication.
Wonderful, sir. Nice.
Thank you, sir.
You and going down your memory lane, and there's so many lessons learned, and I think it's also nice to see Dr. Bagdi, Dr. Kumaran, and Dr.
Good old JIPMER. Good old JIPMER.
Yeah.
The best, yes. Thank
So,
you.
GH is not less, madam.
Thank you.
So on that note, I should conclude this, and I think I also should let Dr. Baliga to go to his clinic. I think a lot of people waiting.
No, not lot of people. I don't see. I get a phone call if there are people waiting. I go see them and come back because these are Corona days. No.
Wonderful, sir. Thank you so much. Thanks for your
Okay,
time.
Thanks,
bye-bye.
Bye.
Thank you, Patta.
Thank you,
Take
sir.
care. Stay
Take
safe.
care.
Yeah.
Bye-bye.